Hi there, I'm Matt Christensen. We're here with another TV6 Investigates Talks. Jen is out today, but I am joined here by TV6 Investigates producer Heidi Connect, and we're going to talk a little bit today about magic mushrooms. We did a story this week about some products that are making Iowans sick and people across the nation sick, and we wanted to bring you some follow-up today and a little bit more about that story. So Heidi, why don't you talk about how it kind of got on our radar?
The Iowa Health Department,
Health and Human Services.
Health and Human Services Department sent out a press release saying that a company, Diamond Shrooms, has some products that consumers were saying made them sick after they consumed it. Across 19 states, people have either reported illnesses or shown up in hospitals, and symptoms range from, nausea, dizziness, vomiting, to, loss of consciousness, and some people are on ventilators. But when we looked into it, the FDA has been investigating this since early June in other parts of the country. But Iowa just saw its first case in eastern Iowa this week.
Right, and health officials, they haven't said where in eastern Iowa that product was bought from, but they are saying that anybody who has it or is selling it to immediately toss that product because, like you said, it's putting people on ventilators. The condition of the people in Iowa isn't known yet either. The HHS didn't say, and I reached out to them for follow-up. We didn't hear back, so I'll bring you more when we get those details. But let's talk a little bit more about what the products are themselves. They're marketed as, mushrooms, but that's not really what they are.
No, it's a chemical derivative of psilocybin, the hallucinogen that's in mushrooms. So it's something that's not legislated specifically. So these chemicals are somewhat legal, hazy, gray ground. But it's a chocolate bar and it's gummies. But they don't have the psilocybin in it. They have chemical derivatives of it, what they call designer drugs.
Right, and the FDA, one of the reasons that the products are still out there and still available is because they're sort of classified as dietary supplements, and because they don't have that psilocybin in them, there's not a lot of the government can do at this point, right?
Yeah, so for dietary supplements, they have to follow the law, except the FDA can't inspect them before it goes to market. They can only look at them after a complaint has been made after it's gone to market. So like the FDA is investigating now after people have been reporting getting sick after taking it. But there's nothing they can do before that. Right. So that is what is frustrating some people.
Locally, we also took a look to see if there were cases of this going on in the Quad Cities. I talked to a Genesis spokesman who said that they haven't treated anyone in their emergency departments that have admitted to taking the mushrooms. So that would probably rule out, at least Davenport and Bettendorf from that eastern Iowa location where those products were sold. So, either way, medical experts say, avoid these products in general, but these Diamond Shrooms one in particular, they're the ones that the feds are linking to these sicknesses across all these states.
And you shouldn't be seeing them in stores anymore either, because what the FDA is also telling store owners, put these away off of your shelf. They're not saying anything beyond that really right now, just saying don't sell these.
Right, but there's not a whole lot of power to enforce that. The FDA doesn't have authority to issue a recall in this case. They've been working with Diamond Shrooms to try to get them to voluntarily recall some of these products that they think are linked to these sicknesses. Where we go from here, I think the government's worried that this is going to continue to spread as long as the products remain available to people. Would you say so?
Yeah, and the investigation began in June, and just more illnesses are showing up every week across the country. So it doesn't seem like that's going to stop anytime soon unless people start listening, I guess, and
Yeah, paying attention.
yeah.
I mean, if you're gonna do this kind of thing, you know, listen up. At least to the warnings like this that names are naming specific products. You know, we talked to a prosecutor today who compared this to the synthetic marijuana or the K2 stuff that was available publicly for a while, and this is kind of the same thing, and might not have the same effects, but just the way it's sold and structured and marketed is similar. And we all know what that kind of did to the community. So, you know, this is something that public health officials in particular are really concerned about. Otherwise, they wouldn't be issuing these warnings. You know, but I think the big takeaway here is to, you know, don't do drugs. At least ones you can buy at a gas station or a vape shop. So, you know, I think we'll wrap up for now, and we'll be back next week with another TV6 Investigates Talks. Thanks for joining us, and we'll see you later.